So hey guys, welcome back to my channel, Health and Relationship with YayraRose. Yep, you're a little bit confused looking at me like this. Pretty much just finished this makeup tutorial for my other channel as it's Black History Month. I decided to do something for my other channel. If you are not aware of that channel, guys, what are you waiting for? It's called YayraRose and it's basically about travel vlogs and obviously anything historic kind of thing. So if you don't know about that channel, guys, please head over there to YayraRose, subscribe, and you're going to be seeing this look that is coming out very soon in the next few days. But just because I just wanted to quickly do this video for you before I go and quickly take a shower, that's why I'm sitting here with this makeup, just in case you're wondering. It wasn't done specifically for this video. So anyway, today's video we are going to be talking about UTI. UTI is urinary tract infection. So urinary tract infection is probably one of the frequent infections in women that kind of happens quite often. And I thought it's something that sometimes happens and goes away. I had it once. Let's get personal, okay? I had it once, I'll say about 6 years ago. And that was the only time I've had it. And I'll tell you what I did to kind of get rid of it. It didn't last that long. But then when I was at work the other day, I was talking to this girl who has it frequently, like has it quite a lot. And she was telling me about the medications that she's been taking, and sometimes it gets pretty worse, sometimes it's pretty mild. And I never knew that it's something that is a consistent thing in some people. Like, I mean, how can you have it for that prolonged time? Like, I just didn't understand. I just thought it was an infection that, you know, you use antibiotics, it goes, and then that's it. But she has it, you know, for some time, which I was a little bit confused about. But anyway, today's video we are going to be talking about urinary tract infection. I'm going to tell you what that is, and I'm also going to tell you what you can do to kind of treat it, and also what the symptoms are, in case you're confused of what to look for. Some of you may have heard of it, some of you may not have, you know, heard of it before. But it's an infection, like I said, that is usually found in women. So more than 50% of women, study says, that will develop a UTI and a UTI syndrome in their lifetime. And also because antibiotics are the most common treatment for UTI, a bacteria has become antibiotic resistant. So you may be asking, what is UTI? What is urinary tract infection? It's usually caused by a bacteria from your poo, from your feces, from, what are the names there for poo? Entering the urinary tract. So, for example, the bacteria enters through the tube that carries the pee out of the body, which is the urethra. Okay, now women have a shorter urethra than the men, which means the bacteria is more likely to reach the bladder or the kidneys and cause an infection. But the best way I would say is wipe from the back. So let me I think I was a bit too quick with that information. Urinary tract is when basically is when you have a poo and you basically do not wipe your anus very well, or you're wiping your anus, you wipe from your anus to your wee area, your urethra. So if you're talking about women, we're talking about where you pee from. You're wiping from the back to the front, and the poo obviously goes into where you wee and then travels into the bladder and obviously causes the infection and spreads the bacteria over there. So the best way to make sure that doesn't happen is to wipe from the front where you wee from all the way to the back, and then wipe out. That's how I've always wiped it anyway. But yeah, I hope that's not too much information. But always remember to wipe from the front all the way down to the back, not the back to the front. That's how infection is spread. Okay. UTI is especially among sexually active women as well. Say between 18 and 24. It can be, that's typically the age that they've, associated UTI with, but it can be any age. People who are sexually more active than others. Although it's a life-threatening, it does cause pain. Although it isn't a life-threatening, it does cause pain though. It's the most, I don't even know how to describe it, because I've had it before. I can tell you how mine was. When you're peeing, when you have it and you're having a wee, it actually stings, like you're trying to hold the wee back because of the pain that you're feeling. So what I tend to do, I think I'm jumping the gun, I'm going to tell you over here, but what I found was a relief for me at the time was having a wee while I'm showering, or while I have the shower down there, just so that there's something kind of diluting the bacteria or the whatever is in the wee that is making my whatever stink. Do you know what I mean? You can have like a salted bath as well. That is usually cool and very soothing as well. But yeah, it's not life-threatening, but it's quite painful when that happens. It happens, you feel the pain when you're weeing. Yeah, it stings. It's a pretty bad sting, like a burning sensation kind of thing. Okay, so let's head to the symptoms. Like I said, the symptoms are kind of like a pain when urinating, you like a burning sensation. And the other one is like you want to pee more. So you're needing to pee more often. But only small amounts that come out, like you craving to wee more often, but only small amounts come out. And you get abdomen pain as well, you get tiredness, you get weakness, and the wee can smell quite strong as well. I didn't get that for my symptoms, but this is something that happens for other people. You get strong smelling urine. The urine kind of appears cloudy as well, more yellowy as well. Sometimes you get the blood in the pee as well. So these are things that you need to seriously look out for and not ignore. Usually clears up within 3 days. Like I said, mine was a very short period of time because I treated it quite quickly. It can last up to 3 days of treatment. And also the more serious causes are seen in elderly women. People with suppressed immune system as well have a longer period of recovering, and also pregnant women require antibiotics. People, when you have it, antibiotics, it's can quickly treat it as well. So here are some of the top home remedies that you can try as well, not just antibiotics. There are other options that you can try. So you need to drink plenty of water, which helps flush out the bacteria. Very simple, very logical. Really, if your wee is very yellow and very cloudy, it means you're not drinking enough fluids. So make sure you hydrate yourself with that. Urinate often when needed. Also urinate soon after sexual intercourse in order to flush out bacteria as well. Holding your urine allows bacteria to multiply. Okay, so make sure you don't hold your urine. Make sure as much painful like it could be, make sure you urine when it's needed. Do not hold it in. And urinating after a sexual intercourse is a very I would say a very good idea, because obviously you've been released into, or there's been sperm that obviously can carry bacteria as well going inside of you. that needs to be flushed out as well. So just make sure you have a shower after every sexual intercourse. Also stay clean and dry down there. Wipe from the front to the back, guys, like I said, especially after a bowel movement. Very, very important as well. And also another thing is to wear loose fitting clothes, which allows air to go down there. There's no point wearing tight jeans, tight panties, things that is, you know, G-strings and tongues like that thongs that are going to be wedging your bits and everything, making you more uncomfortable when you're already painful down there. Come on, let's be logical. Wear something very loose that's going to allow air to go inside. Usually when you're at home, I would recommend going commando. Just don't wear anything when you're at home and just let the place breathe. That's what I sometimes do. Let the place breathe. Don't choke the area. And also using unlubricated condoms can irritate. So my advice is to stay away, honestly, from sex when you have UTI, because it can be quite painful. Stay away from sex. And also, as it says, unlubricated condoms, there are some that are lubricated, some that are not. And the ones that are not lubricated can kind of rub the area and make it quite difficult. Also, the other thing that I want to leave you with, some of the home remedies and some other things that you can try is cranberry juice, which are supposed to decrease the number of UTIs in the person over a 12-month period. Cranberries is supposed to be quite good as well. It's a preventive strategy that you can use. Don't wait to have UTI before you start eating cranberry. But yeah, garlic is also another acetylene. One of the active principles of freshly crushed raw garlic. Have it raw, okay? There's a lot of action-packed stuff in garlic and ginger as well that can help you. Also, clove oil is supposed to be taken internally for 2 weeks at a time. Oregano oil is supposed to be another thing as well that you can use. There are quite a few things that you can use, so do not sit there and just not do anything about it. It would not go by itself unless you treat it with antibiotics or some of these home remedies that I've just mentioned. So guys, it was just a quick video to let you know I'm going to wash this thing off right now. So I hope you do come back next week for another video. Please do subscribe if you haven't yet, and also don't keep all the information to yourself. Try and share it to your family, friends, or your loved ones as well. So guys, stay healthy, stay blessed, and I'm going to see you in the next video. Okay, take care. Bye.